And a quote from the Wall Street Journal, which had an article about Canada's children's medication shortage. Mark Parrish, president of the International Federation of Pharmaceutical Wholesalers, a trade associations with members in 19 countries, says that no other country is experiencing similar shortages as Canada is. That forces our parents to drive south of the border and buy the medications in the United States where they are abundant and in supply, and bring them back here. Many people are actually hawking them with a profit back in this country. Again, why are these medications available abroad but not here at home?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I'm pleased to repeat the answer in English this time. The question is right. No, the stress that families and children are going through is real. That's why we were pleased with collaboration with other producers and retailers, partners over the last few weeks to see an increase, a substantial increase in the production, home production of analgesics for children. But more importantly, Mr. Speaker, just a few hours ago, we announced an important importation of a few months additional supply of analgesics for children, which will make a big difference in the ability of children to be cared in Canada.
Across Canada, there is a children's Tylenol and Advil shortage, and now hospitals are dealing with a lack of pediatric antibiotics. Mr. Speaker, it's a scary time to be a parent, and there are things this government can do now. Instead of vague promises and pointing fingers, the Liberals must ensure our kids get the medicine they need. Parents are desperate for help. Where is the plan to care for our children?
The Honourable Minister for Health.
Thank you, Mr. Speaker. Families and children are indeed living through stressful times today, and that's why we were pleased to announce just a few hours ago that there will be a special importation of additional analgesics, the equivalent of several months of normal supply, in addition to the increased domestic production of these analgesics, so that children and their families can have access to those drugs in the very short time, and therefore we'll keep working on a longer-term solution to these shortages. Thank you, Mr. Speaker.